Hello and welcome. Today we're diving deep into diabetes mellitus, a widespread and often misunderstood metabolic disorder that affects millions worldwide. We'll explore what causes it, how it impacts the body, how it's diagnosed, treated, and what the future holds in terms of research and prevention. So, let's begin our journey to understand diabetes mellitus. The story of diabetes mellitus begins with a disruption in how our bodies process glucose, the sugar that fuels our cells. The primary culprit is a malfunction related to insulin, a hormone produced by the pancreas. In type 1 diabetes, the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This results in an absolute deficiency of insulin. In type 2 diabetes, the body becomes resistant to the effects of insulin, meaning that insulin isn't able to effectively signal cells to take up glucose from the blood. This is often accompanied by a relative deficiency of insulin, where the pancreas can't produce enough insulin to overcome the resistance. Several factors contribute to the development of type 2 diabetes, including genetics, obesity, inactivity, and aging. Gestational diabetes, a third type, develops during pregnancy when hormones block the action of insulin, leading to high blood sugar levels. Now, let's talk about what happens inside the body when diabetes takes hold. In a healthy individual, after a meal, blood glucose levels rise. This triggers the pancreas to release insulin. Insulin acts like a key, unlocking cells to allow glucose to enter and be used for energy. Any excess glucose is stored in the liver and muscles for later use. However, in diabetes, this process is disrupted. In type 1 diabetes, the lack of insulin means glucose can't enter cells effectively, leading to buildup of glucose in the bloodstream, a condition known as hyperglycemia. The body then begins to break down fats for energy, leading to the production of ketones, which can cause a dangerous condition called diabetic ketoacidosis. In type 2 diabetes, insulin resistance means the key is no longer working as efficiently. The pancreas tries to compensate by producing more insulin, but eventually it can't keep up, resulting in elevated blood glucose levels. Over time, this chronic hyperglycemia damages blood vessels and organs throughout the body. Diabetes mellitus is a global health concern, affecting people of all ages and backgrounds. Type 2 diabetes accounts for the vast majority of cases, often linked to lifestyle factors. The prevalence of diabetes has been steadily increasing in recent decades, driven by factors such as rising obesity rates, aging populations, and increased urbanization. Certain ethnic groups, including African Americans, Hispanic Americans, Native Americans, Asian Americans, and Pacific Islanders, are at a higher risk of developing type 2 diabetes. Type 1 diabetes, while less common than type 2, typically develops in childhood or adolescence, although it can occur at any age. Understanding the epidemiology of diabetes is crucial for developing effective prevention and public health strategies. The signs and symptoms of diabetes mellitus can vary depending on the type and severity of the condition. Common symptoms include frequent urination, especially at night, excessive thirst, unexplained weight loss, increased hunger, blurred vision, slow healing sores, and frequent infections. In type 1 diabetes, symptoms often develop rapidly and can be severe. In type 2 diabetes, symptoms may develop gradually over many years and can be subtle, making early detection challenging. Some individuals with type 2 diabetes may not experience any noticeable symptoms in the early stages. It's important to be aware of these symptoms and to seek medical attention if you suspect you might have diabetes. Diagnosing diabetes mellitus typically involves blood tests to measure blood glucose levels. The most common tests include the fasting plasma glucose test, which measures blood glucose after an overnight fast, the oral glucose tolerance test, which measures blood glucose levels 2 hours after drinking a sugary drink, and the A1C test, which reflects average blood glucose levels over the past 2 to 3 months. A diagnosis of diabetes is typically made if blood glucose levels are above a certain threshold on 2 separate occasions. In addition to these tests, a healthcare provider may also perform other tests to assess kidney function, cholesterol levels, and other indicators of overall health. Diabetes mellitus is primarily classified into 3 main types: type 1, type 2, and gestational diabetes. Type 1, often called juvenile diabetes, is an autoimmune condition where the body attacks the insulin-producing cells in the pancreas. Type 2, the most common form, is characterized by insulin resistance and a relative insulin deficiency. Gestational diabetes develops during pregnancy and usually resolves after childbirth. However, it increases the mother's risk of developing type 2 diabetes later in life. Less common types include maturity, onset diabetes of the young, or MODY, and latent autoimmune diabetes in adults, or LADE, which are both genetically linked. The cornerstone of diabetes mellitus treatment and management is lifestyle modifications. This includes adopting a healthy diet, engaging in regular physical activity, and maintaining a healthy weight. For type 1 diabetes, insulin therapy is essential for survival. Insulin can be administered through injections or an insulin pump. For type 2 diabetes, treatment may initially involve lifestyle changes alone. However, many individuals with type 2 diabetes will also require medication to lower blood glucose levels. These medications may include oral medications such as metformin, sulfonylureas, and SGLT2 inhibitors, as well as injectable medications such as GLP-1 receptor agonists and insulin. Regular monitoring of blood glucose levels is crucial for managing diabetes and preventing complications. People with diabetes also need regular checkups to screen for complications such as eye disease, kidney disease, and nerve damage. While we can't entirely prevent type 1 diabetes, there are steps we take to reduce the risk of type 2 diabetes. Maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and whole grains, engaging in regular physical activity, and avoiding smoking are all important preventive measures. For individuals at high risk of developing type 2 diabetes, such as those with prediabetes, lifestyle interventions can be very effective in delaying or preventing the onset of the disease. Regular screening for diabetes is also important, especially for individuals with risk factors such as a family history of diabetes, obesity, or gestational diabetes. The prognosis for individuals with diabetes mellitus depends on several factors, including the type of diabetes, the degree of blood glucose control, and the presence of complications. With proper management, people with diabetes can live long and healthy lives. However, uncontrolled diabetes can lead to serious complications, including heart disease, stroke, kidney disease, nerve damage, eye damage, and foot problems. Recent research has focused on developing new and improved treatments for diabetes, including new insulin formulations, artificial pancreas systems, and cell-based therapies. Researchers are also working to better understand the underlying causes of diabetes and to identify new strategies for prevention and early detection. Advances in technology, such as continuous glucose monitoring systems and telehealth, are also improving the management of diabetes and empowering individuals to take control of their health. The journey to conquer diabetes mellitus continues, with each new discovery bringing hope for a better future. Thank you for joining us on this informative journey.